Well, welcome everybody. January 7th here with Anna Cruz from the Fresno County Department of Public Health. And we are going to look at some numbers today, just give you an update. We haven't done one of these since before Christmas. So wanted to check in and see how we're doing. Obviously, not good news, but it's good to stay up to date of what the information is. So good morning, Anna. I'll give it to you.
Okay. Hi, good morning, Andrew, and good morning, everybody. And Andrew's right. The last update we did was just before Christmas. So as you'll see on the screen, we have the numbers from the 23rd and then the numbers from yesterday. So it's about 2 weeks in between. So the numbers reported yesterday, or total cases, were 70,971. So that was an increase of about 11,000 total cases. And then total tests received and processed, we are at about 598,775. There was no number at our last report, so I couldn't give an increase for this data set. Total deaths currently reported as of yesterday was 711, so that was an increase of 151. And currently hospitalized is 695. And that also was a big jump, an increase of 135. And then recovered, currently we have no update since our dashboard is currently under construction. So if you actually go to our dashboard, and I have the link here, it's fcdph.org/COVID-19 data. There is a couple new data sets available. So it just gives the totals for our county. So the total numbers and our positivity rate, and then the impact in our hospitals. So it does give some information about how many are currently hospitalized and then our ICU capacity. But go ahead and check it out daily. It's slowly being construction, updated every day. So go ahead and take a look if you'd like. Next slide, please. Okay, so hospital capacities, I did talk a little bit about that previously. So currently we have 695 patients hospitalized with COVID, and you'll see here on the screen, I did take this from our dashboard, and then our ICU capacity is currently 6 beds available. And again, this can change daily and hourly, but at the time we have 6. So currently, just some updates about hospital capacity is that the situation in our hospitals is not good. Hospitals are definitely at capacity and overwhelmed. But in order to help, the state has deployed some technical assistance teams, and they will be here to help with decompression, space, equipment, supplies, staff, and oxygen. And then the state is also sending 32 ICU nurses to the Valley. We know that St. Agnes will be receiving a few nurses, as well as Kauai Delta. But they will be across the Valley, not just for Fresno. And then just an update on our state regional stay-at-home order. If you remember, it was originally a 4-week minimum from December 6th through December 27th, but our region did not meet the requirement to exit that order, and that's due to our ICU capacity for the region. So it was announced on December 29th that the order for the San Joaquin region would be extended and in place until our ICU capacity is equal to or above 15%, and currently we are at 0%. Next slide, please. Okay, so updates on state COVID-19 updates. So we are currently still in the purple tier. You'll see on the screen our numbers were updated on January 4th, so just this week. And our positivity rate has increased to 17% from 16.6. Our case rate also went up to 61.6 from 56.2. And then according to the state blueprint for safer economy, and these are for numbers ending the week of December 26th, our county is currently providing about 4,000 to 5,000 tests daily, which is good. It helps our numbers. And then the health equity metric reported this week is actually down a little bit from last week. So this week it was 17.9. And last week it was reported at 18.5. And we can say that this success of, that health equity metric being right aligned with our positivity rate for our county is due to, the additional testing that medical providers are providing, FQHCs, and as well our COVID equity project, that they do additional testing, education, and outreach for our county. So the messaging here for our CBOs, please remember to reinforce the same messages we've said since the beginning: stay at home, no gatherings, masking, maintaining your physical distancing, hand washing, staying home if you're sick, and promoting all of our testing opportunities. Next slide, please. Okay. And we do have a few new guidances available this week on our website. The first one is we have a new health officer order for school surveillance testing. If you'll remember, there was a requirement for school surveillance testing at the end of last year, so it had to be done by December. So this order was updated so that schools can test at least 10% of their staff between January of 2021 and March 2021. So that was updated to update the date. The second document that was updated was the return to school guidance with template letters, and that was updated on the 5th. And the update that was made to this document is it updated the new quarantine for 10 days for close contacts. And then lastly, there was a new state public health officer order. Again, this is from the state. The guidance here states that all counties within that are under the regional stay-at-home order, which is our county, our San Joaquin region, should prioritize services to those who are sickest and prioritize resources for providers that are directly caring for them. So this is just a overview of that whole order, but there's a lot more language in there, but this is specifically for prioritizing resources for the hospitals and patient care facilities that are providing care to patients that are have COVID-19. So more information, if you'd like to click on that link, is available there for you. Thank you. And then just a reminder, we do have the Optum testing locations, the new ones available in Coalinga. We did hear a few weeks ago that the sites were not being well utilized or utilized to their full capacity. So our message here is to please promote these Coalinga testing sites. The additional information that we have this week is, well, this was actually already on the flyer. There is a dial-a-ride service available in Coalinga. So if any Coalinga residents need transportation to one of the testing centers, there is that service available for the city of Coalinga. Perfect. And then 2 new testing events happening this week. So Friday, January 8th at Sanger High School West Campus from 9 a.m. to 1 p.m. And then also this Saturday, January 9th, there will be a testing event from 9 a.m. to 1 p.m. at the Carruthers Neighborhood Library. Next slide. And then also this Saturday, January 9th, there will be a testing event at the Kingsburg Fire Department Station from 10 a.m. to 3 p.m. And then there is a new weekly testing site available at Central High School East Campus. And they will be conducting tests every Tuesday from 9 a.m. to 3 p.m. And this will go all the way through March 1st, 2021. So that's a new testing site available for our community. Thank you. Okay. And then just some COVID-19 vaccinations updates. So this is as of January 6th, which is yesterday, an estimated 44,000 doses have been received at the Department of Public Health, and 47% of those doses have been redistributed to healthcare workers. This does not include the doses that the VA, Veterans Affairs, Adventist Health, or Kaiser have received, since they have received their own vaccines directly. So the current effort or focus of the vaccine team is distribution of phase 1A, which is healthcare workers and long-term care facilities. But phase 1A does have 3 tiers. So currently the efforts for vaccination distribution has been in tier 1 and tier 2. This does include hospital workers, paramedics, firefighters, dialysis centers have all received vaccines or have been vaccinated. Home healthcare workers will receive vaccines at the Fresno Fairgrounds this week, and they are part of tier 2 under phase 1A. And it is estimated. So as of right now, we don't know if this may change in the next day or week or so, but vaccine distribution for tier 1B will begin in late February, and for tier 1C, it will begin in March. So this is an estimation as of this current time. There will also be a registration system available to schedule vaccine appointments for current and future phases, and this will be rolled out in the next few weeks. Lastly, maybe you've heard in the news, but there was an order signed by the Department of Consumer Affairs this week on January 4th. They have granted a waiver to allow dentists to order and administer COVID-19 vaccination. So more information to come on that and on vaccine updates in general.
No worries, Anna, if this puts you on the spot, but tier 1 and tier 1B and tier 1C, who makes up that tier? Do you know that?
Yes. So, and actually, if we want to go to the next slides, I have a little bit more information on here. So this is just to give you a snapshot of what the phase 1A looks like and the 3 tiers. So currently the vaccine distribution has been in tier 1 and tier 2. And then under tier 2, like I said in the previous slide, home healthcare workers are one of the first people to receive vaccines or be vaccinated under this tier. Community health workers and promotoras are also included under this tier in phase 1A. So we'll definitely need help from the CBOs to reach out to these people and get them registered once we have that registration system available. But again, more information to come. This is all we know for now. So again, under phase 1A, these are the 3 tiers. And the 3rd tier will include other settings, healthcare workers, laboratory workers, dental, and pharmacies that are not included in tier 1 or tier 2. Okay, and then just a quick snapshot of phase 1B. So under phase 1B, there are 2 tiers, so tier 1 and tier 2. And you'll see under tier 1, it's individuals 75 or older, and those at risk of exposure at work in the following sectors. So education, childcare, emergency services, food, and agriculture. And then tier 2 under phase 1B will include individuals who are 65 through 74, and then those at risk of exposure in the following sectors: transportation, logistics, industrial, commercial, residential, sheltering facilities, and critical manufacturing. And then also under this tier would be congregate settings with outbreak risks. So that does include incarcerated and homeless individuals. All right, and then phase 1C will be individuals 50 to 64 years of age, and then also people 16 to 64 years of age who have underlying health conditions or disabilities, who also have an increased risk of severe COVID-19. And then lastly, those at risk of exposure in the following work sectors: so water and wastewater, defense, energy, chemical, hazardous materials, communications and IT, financial services, government operations, and community-based essential functions. So as I said before, the current estimation is late February for tier 1B and tier 1C in March. But again, this is just an estimate as of this point in time. This could definitely change in the next few days or by next week. So again, we'll have more information for you all on our next call.
Great, thank you.
Okay, and then lastly, like we always do, just our slide of resource links. I did for all the information about the 3 phases that I just talked about. It's under the Vaccinate All 58 campaign. You just have to scroll down; it'll give you more information. And then if you're more interested in the current phase that we're in, I did provide that direct link for phase 1A, and it'll give you all the folks that are available to get or that are eligible to get tested at this time. But again, that's all I have for you today. And so thank you all, and please stay safe and healthy, and we will see you all next week.
Awesome. Thank you so much, Anna. Yeah, stay safe out there. This is the time that, by every estimate and every
Yeah,
number, we're in the worst that it has been.
for
So
sure.
really
Yeah.
keep that out there. Thank you, Anna. And then join us next week. So next Thursday, we're going to be hearing from the police commission. So we're going to do an update of what were their findings, what is kind of with the new police chief and Fresno, what does that mean for us? So we're going to be hearing from Sandra Celadon and Oliver Baines of the Fresno Police Commission. So looking forward to that update. And then obviously as well, we'll get some news, and maybe, who knows, that portal and registration process will be open, or the dashboard updated, we'll see. So we look forward to joining you next Thursday, and we'll see you then.